Good evening and welcome. My name is Anita. I'm a program specialist with Gilda's Club Kansas City. We're so happy to have everyone here this evening. And I would like to introduce Dr. Whitney Hensing, talking tonight about cancer risk in African American patients. She's a medical oncologist at St. Luke's here in Kansas City with a specialty in breast cancer. So Dr. Hensing, thank you so much. We are very happy to have you, and I am going to hand it over to you.
Thank you. Yes, so I will be talking about cancer risks in African American patients. And this will be just a general overview with statistics about cancer prevalence and risks, most common types of cancer, and risk factors and prevention and screening recommendations. Again, I specialize in breast cancer, so this is an important topic in the field of breast cancer. And of course, any questions are welcome, but especially those kind of geared towards breast cancer, I can give you a little bit more information about. But we'll get started. Um, so I just have a few relationships to disclose, nothing related to this talk. And these slides were reviewed in January 2022, so they are pretty up to date. Um, and we're reviewing cancer risks among African Americans. And why is this important? So in 2019, there were roughly over 200,000 new cases expected to be diagnosed among African Americans in the US. And cancer is actually the second leading cause of death in African Americans in the US after heart disease. So it's a very important topic. The leading causes of new cancer cases and cancer-related deaths among African Americans in the US. So for men, the most common cancers are prostate, lung, colon. Among women, the most common cancers are breast, lung, colon. The most common causes of cancer-related death among men are lung, followed by prostate and colon. And in women, the same. Lung is first, followed by breast and colon. So those are kind of the main cancers that we're going to focus on today. This chart gives us a comparison of cancer rates and death rates comparing Blacks to whites in the US. In both males and females. And these charts highlight that collectively, African Americans have the highest death rate and the shortest survival of any racial or ethnic group in the US for most cancers. And Black men actually have the highest cancer incidence rates. And you can see that these curves are coming together over time, but still there is a difference and a disparity that exists. So researchers are studying why African American men and women are more likely to be diagnosed with or die from certain cancers compared to white men and women. And the reasons are many and complex. And these are just a list of some of the potential reasons. That includes lack of access to quality healthcare, health insurance status, discrimination by healthcare providers, differences in education, differences in housing, exposure to environmental pollutants, access to healthy foods and prevalence of obesity, exercise and sedentary lifestyles, and then biological and genetic factors that increase risk for certain types of cancers. And then importantly, decreased access to cancer clinical trials and a historic lack of representation of African Americans in clinical trials, which I feel definitely contributes to these disparities. So next, we'll further look at some of the most common cancer types diagnosed in African American patients. As I mentioned, the most common cancer types among Black men are prostate, lung, and colorectal. Among Black women, breast, lung, and colorectal. Starting with prostate cancer, So African American men actually have higher rates of both getting and dying from prostate cancer than men of other racial and ethnic groups in the US, and that's highlighted by this bar graph on this slide. You can see in green the incidence, and then in red the mortality from prostate cancer. Um, for prostate cancer symptoms, usually there aren't any early warning signs or symptoms of prostate cancer. That usually is rare cases where that happens. But these are some of the signs and symptoms that you might look out for. One being a need to pee frequently, especially at night or urgently, difficulty starting or holding back urination, weak dribbling or interrupted flow of urine, pain when burnt or burning when urinating, difficulty having erection or decrease in the amount of ejaculate, blood in the urine or semen, pain or pressure in the rectum, or pain or stiffness in the lower back, hips, pelvis, or thighs. In 1994, PSA test or prostate specific antigen blood test began to be used as a screening test for prostate cancer. And the belief was that screening would reduce the rates of prostate cancer deaths. So PSA is a protein that's produced by cells in the prostate gland. It's also produced by normal cells and by cancer cells. So the test measures the level of PSA in the blood, and they can often be elevated in men with prostate cancer. But there are some downsides to PSA screening um, because there's um, many healthy men who are being routinely screened with PSAs could have elevated PSAs not related to cancer, but due to benign non-cancerous conditions like benign enlargement of the prostate. Um, and there was no evidence that because they have enlargement of the prostate, they're next necessarily going to be increased risk of prostate cancer. Um, but this, elevated PSA then leads to more and more testing being done. And so results from the that have looked at prostate cancer screening have found that screening offers a small chance of reducing the man's risk of dying of prostate cancer, but it can also lead to false positive results, which can lead to more tests and overtreatment. And these tests aren't benign. You have to go through a prostate biopsy often, which can be a difficult, painful procedure. Um, and then it can lead to more tests and complications like even incontinence or impotence due to the testing, not related to having prostate cancer. So and then also the risk of being diagnosed with a prostate cancer that might not have otherwise really impacted your life or your survival that needed to be treated. So that this has led to an update in the prostate cancer screening guidelines for most individuals who are at average risk. Don't recommend just routine everyone being screened. It's more of a risk benefit discussion and an individualized approach between the doctor and the patient. For men who are between the ages of 55 and 69. The reason they don't recommend prostate screening in men who are much older than that is because, again, the risk of finding a prostate cancer that, because outcomes are so good in low grade prostate cancer, might not have impacted your survival. So that applies to general population of average risk patients. However, we know that African American men are actually considered to be at increased risk of prostate cancer and fall into the high risk group. So, African American men are encouraged to talk to their doctors about their increased risk of developing and dying of prostate cancer. And these patients benefit more from PSA screening than the average risk population, particularly if there is also a family history of prostate cancer, because that's also a significant risk factor. So if you combine risk of being African American, but then also having a first degree relative diagnosed with prostate cancer, especially at an early age, then that is someone who should definitely consider prostate cancer screening. Um, so then moving on to breast cancer. Breast cancer is the leading cause of death among women in the US, second leading cause of cancer death among women in the US, the first being lung cancer. African American women under the age of 40, they're more likely to develop cancer than white women under the age of 40. So there's a predisposition for younger African American women. And the type of breast cancer that develops is a more rare subtype and often more aggressive subtype that is more difficult to treat. These are some of the risk factors for breast cancer, including age. As you get older, the risk for breast cancer increases. Dense breast tissue, family history of breast cancer is important, particularly um, if you have cancer in your first degree relative, like your mother or your sister, and if they were diagnosed at a young age. Genetic mutations. So we know about the BRCA1 and 2 mutations, which are not common mutations, but they significantly increase risk of breast and ovarian cancers. If you're exposed to radiation of the chest before the age of 30, um, and then some menstrual cycle and hormone exposure related history, like if you start your period before the age of 12, if you have menopause after the age of 55, then you have an increased risk of breast cancer. And then there is this DES exposure. So this is a drug that some pregnant women took to prevent miscarriages in the 1940s to 1970s. And so women who took this drug and women whose mothers took it have an increased risk of breast cancer. Other important risk factors include weight after menopause. So, maintaining a healthy weight, not being overweight or obese after menopause is important to reduce risk of breast cancer. And compared to women of other races in the US, African American women have the highest rate of overweight and obesity, actually estimated 80% overweight or obese. So that's an important modifiable risk factor. Not drinking alcohol. So the more alcohol you drink, the higher your risk of developing breast cancer. Not getting enough physical activity. Exercise both helps to maintain a healthy weight, but it also physical activity itself can lower the risk of breast cancer. Some types of birth control pills can increase breast cancer risk. And getting pregnant later in life or not at all, like we talked about with other hormone exposures previously, this is another one because each time you go through your menstrual cycle, that exposes your body to estrogen. So if you don't get pregnant till much later in life or don't get pregnant at all, then you're higher risk for breast cancer. And of course, taking postmenopausal hormone replacement therapy can increase risk of breast cancer. So it's recommended in general to, if you are going to take this, to do it for the shortest period of time and for the lowest dose possible. Um, so getting into the health disparities for breast cancer, African American women are more likely to be diagnosed with breast cancer at a more advanced stage and to experience delays in treatment. And despite having similar incidence rates, African American women are more likely to die of breast cancer than white women. And the highest death rates among African American women are likely being due to being diagnosed multiple factors, but being diagnosed a later stage of their cancer, having other comorbidities along with the cancer, like higher obesity rates, less access to screening, lower access to diagnosis and treatment. And of course, I mentioned before, less representation in clinical trials. Breast cancer signs and symptoms. So, the most common symptom of breast cancer is a new lump or mass that you feel in the breast. It can be painless or painful. It can be tender, soft, rounded. It can have regular edges. Other symptoms include swelling of all or parts of the breast, even if you don't feel a lump in the breast, skin irritation or dimpling. Sometimes the skin, if it looks like an orange peel appearance, that is a red flag for breast cancer. Breast or nipple pain, nipple retraction, that's new. Redness, scaliness, thickening of the nipple or breast skin, nipple discharge, of course, other than normal breast milk when you're lactating, and swollen lymph nodes. So mammography does not prevent breast cancer. It's used for early detection, but Regular mammography does reduce a woman's risk of breast cancer um, by about 30%. Women who risk of dying of breast cancer by 30%, and women who get regular mammograms can still get breast cancer and can still die of breast cancer. So mammography is not perfect. Some cancers will not be seen on a mammogram. Others can grow quickly and they can't be spotted. In that interval between your annual mammogram, a new cancer could come up. Um, Initially, mammogram, when it was first introduced, was recommended for all women starting at the age of 40. But again, as more women were screened, more breast cancers were found. We didn't find that mammography had a dramatic impact in reducing breast cancer deaths. And doctors realized that mammograms were finding breast cancers that may have never gone on to cause death, and which is another example of overdiagnosis or treatment. And it's been an ongoing debate for decades about what age women should begin mammography screening and how often they should have their mammograms. These are the current breast cancer screening guidelines. So the United States Preventative Services Task Force recommends mammography every other year for women aged 50 to 74. And again, this is in an average risk population. And they say for women aged 40 to 49, discuss the risk and benefits of screening with your doctor. And again, this is for high or average risk population. If you have higher risk, then you might benefit from more screening. The American Cancer Society recommends the option again to screen between age 40 and 44. They actually lower that age to start mammography screening to age 45 and recommend mammography every year. And then 55 and older is when they start recommending you can switch to every other year. And screening should continue as long as you're in good health and expected to live 10 more years. And for women who are at higher than average risk, that includes people who have a strong family history of breast cancer, um, people who have been tested or found to have the BRCA mutation or have had that chest radiation before age 50. Those are major risk factors for breast cancer and a reason to actually begin screening at a very early age using both mammogram and MRI, actually starting at the age of 30. And I will add here that there is an intermediate kind of more than average risk, not quite high risk population who could still start, be more towards screening at that earlier age if you have some of those more minor risk factors that we talked about. So it's important to kind of share your risk factors with your doctor and then make a decision about when to start screening. Okay, so for lung cancer, um, lung cancer, I mean, African Americans are diagnosed with lung cancer at a higher rate than in other racial or ethnic groups in the US. Um, Black men are more likely to be diagnosed with lung cancer than white men, but Black women are less likely to be diagnosed with lung cancer than white women. And this pattern reflects historical, racial, and gender differences in smoking patterns because smoking is, the number one risk factor for lung cancer. And African Americans have a lower survival rate um, with lung cancer. Risk factors for lung cancer, the number one is smoking. About 80% of lung cancer deaths are related to tobacco use. Secondhand smoke is also a risk factor. So these are people who don't smoke themselves but are exposed to other people's cigarettes, either at work or in the home. Radon's a naturally occurring radioactive gas, which you can't see or smell. It's the second leading cause of lung cancer in the US, and the leading cause of lung cancer deaths among non-smokers. So, homes and buildings should be checked to see if there's exposure to high levels of radon. Asbestos exposure comes from working with asbestos. Those people are more likely to die of lung cancer. And if you smoke and are exposed to asbestos, then those two together really increase risk. Other workplace exposures, you can inhale carcinogens such as arsenic, uranium, vinyl chloride, coal products. These can all increase your risk of lung cancer. Arsenic in drinking water. This is more likely to be a concern if you get well water. Um, Being treated with previous radiation therapy can increase risk of lung cancer, and then, of course, a personal or family history of lung cancer. Um, Lung cancer can present with symptoms. It doesn't, these symptoms are kind of nonspecific. If you have them, it doesn't mean you have lung cancer, but it's something that you should definitely talk to your doctor about. So if you have a cough that doesn't go away or the cough becomes more and more intense, if you have pain in the chest, the shoulder, or the back, um, a change in the color or volume of the mucus that you cough up, shortness of breath, changes in the voice or becoming hoarse, hearing harsh sounds when you take a breath. If you have recurrent lung problems like recurrent pneumonia, then that could be a sign of an underlying lung cancer. Coughing up phlegm or mucus, especially if it's tinged with blood, or coughing up frank blood. So this is the recommendations for lung cancer screening. Lung cancer screening is newer than prostate and breast cancer screening, and it has shown to significantly reduce lung cancer mortality by about 20%. So, in patients who have a history of smoking, recommend to undergo annual screening with low dose CT. So, that's anyone with a 20 pack year smoking history who currently smoke or have quit within the past 15 years. And then colorectal cancers, the last one, African Americans have the highest colorectal cancer incidence and mortality rates of all racial groups in the US. Oh, sorry. It's the third most common cancer in Black men and women. Um, and the incidence rates of colorectal cancer are decreasing um, at a little bit slower rate compared to white patients. So some of the symptoms of colorectal cancer, again, it doesn't always have symptoms, but these are some symptoms that can be a red flag, including blood in the stool, narrower than normal stools, unexplained abdominal pain, unexplained changes in bowel habits, unexplained anemia, or an unintentional weight loss. And as you get older, risk of colorectal cancer goes up. Other known risk factors include being overweight or obese, physical inactivity, a diet that's high in red or processed meats, eating meats cooked at a high temperature, smoking, heavy alcohol use, having previously been diagnosed with a colon polyp, having inflammatory bowel disease, having a family history of polyps or colorectal cancer, and having an inherited gene that is associated with a colorectal cancer syndrome, such as Lynch syndrome or familial adenomatous polyposis. And having diabetes is also a risk factor for colorectal cancer. These are the screening recommendations for colorectal cancer. And next slide, we'll talk about the ways that you can do colorectal cancer screening. So the United States Preventative Services Task Force recommends screening everyone at the age of 50 and continuing until age 75. Beyond that, having a discussion about your health and the benefits of screening. The American Cancer Society actually updated their screening recommendations, saying that screening should start at age 45 for men and women at average risk. So that's the general population should start screening at age 45. And that the American Society for Gastrointestinal Endoscopy also recommends for African Americans to begin colorectal cancer screening at age 45. So colonoscopy is the only screening test that can also prevent cancer from developing by removing precancerous polyps. So colonoscopy is really the gold standard for colorectal cancer screening, and that's recommended every 10 years. Other options would be a CT colography, flexible sigmoidoscopy, double contrast barium enema, stool DNA tests, fecal immunochemical tests, and then guaiac-based fecal occult blood tests. But again, if you're screened by any other test than a colonoscopy and you have an abnormal result, it needs to be followed up by a colonoscopy because it's also the diagnostic test. Um, so this is some of the ways that you can reduce your risk of getting or dying from cancer. One is to talk about cancer with your family members. Find out which members of your family have had cancer, what types of cancer they had, how old were they when they were diagnosed, and to share that information with your doctor so then you can talk about cancer screening and where you fit on the risk spectrum. If you do have a family history, you could consider undergoing genetic testing. And this could include genetic testing, like for the BRCA gene, if you have a strong family history of breast cancer, or the Lynch syndrome genes, if you have a strong family history of colorectal cancer, for example. If you smoke, quit. We mentioned all risk factors for cancer. Smoking is in almost all of them. Eating a healthy diet. So eating a diet that's low in sugar, includes a lot of fruits and vegetables, whole grains, and trying to avoid, like red meats and processed meats that can increase risk of cancers. Exercising, staying physically active is also important. Um, so walking instead of driving or taking the bus and joining a gym or are good ways to increase exercise. So that was very general, but that's kind of the end of the talk. And if there are any questions, um, I'd be happy to go back and talk about anything a little bit more detail.